amazing Garen Staglin. We're so fortunate to have him here. He's doing incredible work in global mental health, especially as it relates to the workplace. So I just want to give you a little background on Garen. He is a private equity investor, and a philanthropist with over 40 years of experience in building and starting companies. And I think getting someone in business in the happiness and mental health space is so key to moving the agenda forward. So he serves on the board of directors of the Silicon Valley Bank, ExL Services, NVoice Payments, and Profit Velocity Solutions. He and Shari and their 3 children, Brandon and Shannon, are founders of the STAGLIN Vineyards. So they have a winery in Napa Valley. If you haven't heard of it, I highly recommend you check it out. And he's also the co-founder and board chair of One Mind, which was formerly the International Mental Health Research Organization. It's a 501c3 organization. He launched it in 2011 with former Congressman Patrick Kennedy, who's very active in global mental health and addiction. And it's now led by President Brandon Staglin. One Mind is pursuing a number of large-scale public-private partnerships in schizophrenia, TBI, and PTS, as well as funding cutting-edge research with 30 rising star scientists. During the last 20 years, One Mind and the Staglin's Music Festival for Brain Health, which is super fun. He had Jennifer Hudson this year, really amazing. They have raised more than 290 million or $90 million, for mental health charities and research, which is incredible. There's such a lack of funding in this space. So again, having someone with business experience getting involved and really supporting the research behind it and the funding is so important. He's the recipient of the Gold Spike Award, which is Stanford University's highest award for volunteer service, and the UCLA College of Letters and Science Fellows Awards. So how are you, Garen? So good to see you.
I'm terrific. Thank you for having me this morning. We have a beautiful day here in the Napa Valley, sunshine, so that's a key to happiness, right?
That is. Yeah. Absolutely.
Yes.
I know you're hopping on a plane too. It was so nice of you to make time to join us.
Yeah, well, I'm happy you're here. How is your global gathering going here?
It's great. Yeah, it's going wonderful. It's moving super quickly and we're getting great insights, and heard from the World Bank earlier in Chicago. And
okay, good.
Yeah, so it's been wonderful.
Okay. Well, good. So I thought I would talk a little bit about One Mind first. You did a great summary. I'm just going to put things into context and then focus my remarks on workplace mental health. All right?
Perfect. And, yeah, great.
As you correctly mentioned, focused on a exciting set of ideas and agendas. So we are, after Brandon's psychotic break in 1990, we devoted ourselves to getting him well, and we got him back on track, and he went back to Dartmouth College. He wasn't cured, but he was capable, and that was a motivating factor for us to decide where we were going to go with this, and we decided we were going to run towards the problem instead of run away from the problem. And so for that last 25 plus years, we've been pursuing a variety of ways to make the lives of people with a mental illness better. And so our principal mission is radically accelerating cures. If you work with scientists, you'll know that they are not very good at giving you hard deadlines about when they're going to cure or fix something. So, but we can convince them that we can go faster, and that's what we're trying to do. And we do that with our own vision of commitment, integrity, collaboration, and courage. And our overall mission statement is really about healthy brains for all. Here's the things that we're doing as priorities: leveraging sources of major new funding. And you correctly highlighted that we've raised, it's actually the number is 360 million now, instead of 280. And finding major new philanthropic sources, including a project with the World Bank and the World Health Organization, which will be a subject of another conversation when the time is right. So that's moving ahead. And so we're also looking at data sharing, and because we really believe that the way things go faster is if you work together And these single siloed research projects don't really get to discoveries at scale. And it takes much longer, and the results aren't nearly as replicatable, and they don't generally help people. They cure mice, but they don't cure people. And finally, this best practices for fair treatment, hence One Mind at Work. So we launched One Mind at Work in 2017 with a goal to begin to replicate what the CEO Roundtable on Cancer had done way back in the year 2000, launched by President Bush 41, to really set in place standards for workplace mental health, for cancer mental health. Because if you think back 20 plus years ago, people with cancer, they used the C word. They didn't talk about their mental, they didn't talk about their cancer because they were afraid people wouldn't like them, that they wouldn't be promoted, they would be marginalized in one way or another. And that very much is where we still are with people with mental illness in the workplace. So this effort has really accelerated. And so just a couple of facts for everybody on the video. Why workplace mental health? We know that 1 in 3 people that are working age adult experience a mental disorder regardless of age, gender. Maybe the number is 1 in 4, but it's a huge percentage of the population. These are figures about impaired performance. There's the figure on lost productivity we're showing here. Mental health conditions, this is low at 89 billion. And then you talk about all the people in the workplace that are having to spend their time and hours caring for a loved one with mental illness. And that number, all these numbers are growing, not shrinking. What we've been able to prove by implementing these best practices is that studies have shown that, and we need to do this because I think businesses know that it's the right thing to do, but they also need to know that it's good for business, because we need to make long-term cultural and other kinds of changes in their workplace if this is going to actually come to fruition. And so we can actually prove that by improved productivity, reduced absenteeism, productivity enhancements, better customer service, lower workers' comp claims, you'll get a return of 10 to 1, and that's a conservative number for any investments you make. And the investments are not what it costs you to join One Mind at Work. They are implementing parity in your healthcare programs. They are giving people appropriate time off for work after they've done massive efforts to get a audit done or an IPO done or some major research project accomplished. So it's important that these workplace changes take place. And I think, Catherine, you've been at the One Mind at Work effort, and you've seen employers talk about these changes and how profound they have been and positive they've been. So how we're going about doing that is these 4 things. We basically get people and the CEOs of corporations to adopt a charter that has some pillars of success. We share insights and best practices, which is the really important thing. And we shine a light on emerging solutions around the globe. We have partners now in India, in England, Canada, and really finding that we're learning from each other as the best way to go forward with this. And in order to make this all work, we have the C-suite has to sign up for this, because these are enduring changes and they can't just be from the HR department. So here's the things that people are really telling us they're facing in the workplace. The stigma that's there, that's got to be a core priority. A care continuum, that's the transitions in mental health services and usage through sustained care. And I think you and all of those listening know that one of the biggest shortages we have is the lack of trained psychiatrists, both in network and out of network. So the whole idea that perhaps we can develop new digital technologies and digital therapies to allow people to access those are important things that are coming forward. We were looking at ways to understand the real cost of not dealing with brain health. And we actually have created a calculator that allows people just for depression to understand within a very high degree of accuracy what the cost of depression is in the workplace against all those factors. I'm not showing those slides, but if you go to onemind.org, you'll see them. And then the final thing is this issue about access barriers. And we related some of that, not enough care people, but also lack of parity in how people are treated with physical health versus with mental health. You don't have to get a pre-authorization if you've broken your arm. You do if you're going to see someone about your bipolar disorder. So this is really all upside down for what it takes to get people better. And we at One Mind at Work are doing everything we can to provide services and best practices against all of those things. This is just a little idea about what we do. This is a global organization. We've got a unique scope in how we're going about doing this. We're working on policy. I think at the last event, Catherine, you saw that we presented the Evaluate survey, which was done by the National Association of Healthcare Purchasers, which highlighted out of the 50 healthcare plans, the great disparity in how procedures are written and implemented between mental health and physical health. That is something that is going to be a priority in the rest of 19 and 20 to rectify that change. And we're working on tools and services and cost-benefit analysis. And the most important thing is, I was saying, best practices for sharing with others. In that regard, we're pleased to tell you that Forbes has now allowed us to have a blog on their homepage on workplace mental health. And so if you go to Forbes and look for One Mind at Work, you'll be able to see where our first posting is up. And we would invite any of the listeners on this, if you have unique and new content that will help others understand how people with workplace mental health issues are dealing with it, we'd be happy to guest post those articles for you. So we have a very trusted relationship with Forbes, so it can't be an advertisement, it can't be selling anything, but if it's helping people understand, we're happy to promote that content. Here's just a list of some of the employers that are signed up already as members. And we use the term employers carefully here because it's not just corporations. UCLA is a member. I think we're close to signing Brigham Women's, the Department of Homeland Security, anywhere where we have big employing populations. And we're rapidly approaching now 2 million employees if you add up the number of people working in these organizations. And we're also working with these content partners and other ways in which we can partner, share best practices, and work with all of these people. The World Economic Forum is a new one. They're now focusing on workplace mental health, and we hope that we're going to have a chance to talk at the upcoming January 2020 Davos event on the main stage about workplace mental health and help bring more people. They want us and together to have a goal of having 10 million employees globally covered under workplace mental health standards. So those are some exciting ideas. This is the event that you've been at, Catherine. This is our annual global forum. This year it's going to be September 10th through 12th. So again, if there are people on the show that would like to be there and hear how other people are dealing with this, we have to limit the number of people, but we're happy to consider their invitation. So as final slide, we'd like anyone at any organization that wants to join, we would like to include you. For nonprofits, it's free. Academic institutions, it's free, and it's a modest fee for employers based on their size. And for everyone, it's best to share best practice and promote workplace mental health with the goal of getting us to 10 million lives by 2020. So that's just a quick set of slides that I thought would be helpful. So Catherine, thanks for the opportunity to talk about this, and we're very passionate about this, and it's really an important thing because it's you know, you spend what 70% of your waking hours not at home, but at the workplace. And if that's not a place where you feel comfortable in talking about that, and certainly happiness, which is your theme here, you're not going to be happy if you're afraid that if you tell somebody about your condition, you're going to end up in a position of being marginalized in some way or promoted or put to the back of the line relative to promotions and other activities that you want to be treated as an equal and allow your own unique skills to shine through.
Yeah.
Mm-hmm.
Absolutely. And I want to commend, first of all, the work you're doing at One Mind, because when we look at stigma and stigma being a primary reason that people aren't getting treatment, and I think also a primary reason that we're not getting funded in this space, you're doing all of the things that are key to that, which are engaging with celebrities and thought leaders on mental health and speaking about their own issues. It's talking to the media about it. It's changing leadership in the workplace and how they're talking about it, you know, and it's focusing on the positive, the solutions, and then the biology of the brain, which is so important. So you're making such an impact on stigma overall in the work you're doing. And, you know, clearly as it relates to workplace, I lost my father when I was 19 to suicide, which is what kind of drove my own work in the space and in mental health and passion about it. And he was in banking and he was in finance and he was a retail banker. And so when I learned about your work and what you're doing, and especially when the World Bank too came out with the reports on the positive return on investment for investing in mental health, it's so hard for me to understand why, and we've had a lot of this research on the positive return on investment for a while. It's just more recently that it's been very quantifiable. 4-to-1 return in the general and then the 10-to-1 in the workplace. So why do you think CFOs aren't taking action? I mean, or the leadership? What are you hearing? I mean, is it?
Well, I think they, in some case, there's a very naive point of view about this that, well, look, we have an EAP program and therefore we're providing treatment for people with these illnesses and therefore we must be, you know, what else do you want us to do, right? So the whole idea about understanding how to start, that's the thing that we really find. I think that if we can get an engaged conversation with a C-suite officer, they get it and they understand that, and we can provide the economic justification. They know it's the right thing to do, but we give them now the proof that it's good for business. Just like everybody in their own workplace, every one of them has a friend, a family member, or a personal issue. If we take the illnesses from autism all the way to the far end of dementia, Alzheimer's, and Parkinson's. So because it affects everybody, we can usually then have that conversation and they understand it, or their son or daughter is dealing with an eating disorder or anxiety and depression. So if it's not in their own workplace, it's at their homes. And for every employee, there's 2.2 dependents covered under their own healthcare policies. So you can see this is a big multiplier effect by working on the workplace and their dependents. And by leveraging that, I think we're going to be able to really do a much better job in awareness and stigma reduction. One thing I did want to say, which I do believe you referenced, Catherine, is that we're quite excited that PBS and Ken Burns have now agreed to partner with us in a 10-year documentary series on brain health and mental health. And we are actually in production on the first film, which will be the youth mental health crisis. And Ken is such a great documentarian, and the 350 stations across the nation, and the content will get repurposed into 2 million teachers. So every school will have the content will come from this. He takes quite a while to do it because he does it right, but we'll actually be starting to do activations, which will be bringing sponsors and celebrities to cities across the country beginning in the fall of this year. So stay tuned for some very high profile people to be engaged. And sports celebrities and networks are going to come alongside with us. So we're quite excited that after a long time, we can bring brain health and mental health out of the shadows and on the front line here. That's where it needs to be.
That is wonderful, and especially in youth and the rising among youth and just the challenge we're going to have with youth and depression and anxiety. So it's really great that you're tackling it too from the States and bringing the celebrities local, which is going to be really good for the kids. And I mean, because we have solutions, it's just a matter of getting them out to the bigger population, broader population.
And if they hear it from a celebrity, we're also engaging some of the most the influencers on social media. You know, some of these kids have 50 million people that follow them. So we're bringing them into this as well. And so I think it's the more people tell them that it's okay to have the illness and it's not okay to not get help. That is, I think, the kind of messaging that has to happen. And if they hear it from a ball player or a music celebrity, it's going to be easier for them to feel like they're not going to be marginalized some way if they do it. The number one cause of fatality of teenage girls is suicide from anxiety and depression. So just point that out. Isn't that terrible?
It is.
Yeah. It's something we all need to collectively try to create a national emergency about.
Absolutely. And there was a recent study that 36% of girls are self-reporting depression before they reach 18. I mean, that is a third, 1 in 3 girls, and so absolutely something that has to be addressed, and what the work you're doing is really going to help in that and help drive, I think, the positive change that we need to see. And like you said, it's a national emergency. I mean, this is, has to be. So it's incredible. Yeah.
Some statistics that I find that really helps get people to understand this. I'm going to give you daily averages. So this is on average across the United States today. 40 people are going to die in a car accident, and you will read about every one of them. This is from New York to Nebraska. And as a country, we spend $140 billion to keep our roads safe and our cars safe. Today, 50 people are going to be murdered. You will read about every one of them probably several times over a course of several days. And we spend $180 billion with our local police forces, not counting our Department of Homeland Security. And today, 110 people will take their own lives, and 2,200 will try. And unless it's Robin Williams or Kate Spade or Anthony Bourdain, you will not hear about one of them. And our entire federal budget is less than $10 billion for what we spend on brain health and mental health services. So that is totally upside down, right? It's like 1/20th for a problem that is more than 20 times as much. So that is the data that I think is going to help us make people understand this is a national emergency, and we do need to, as a country and as a global community, get on top of this. This is why the work that Shekhar and Vikram are doing, and at the World Bank and World Health Organization. I think you have Devora on today at some time later. But these efforts are critical, and that we join hands and raise this up as a priority, not just from its economic burden, but from the tragedy of people's lives that are affected so profoundly by these things.
Absolutely, absolutely. Yeah, and we'll put the statistics in the sidebar. Those are really good numbers. So I'm curious, when you look out then at all of the work you've done today and kind of looking at the future, what is bringing you the most hope and inspiration and moving this? Like, what do you see as the most hopeful?
Well, our principal focus is the science. So I think we've never had better science. 10 years ago, if you said, if we give you more money, can you go faster? We would say, nah, maybe. Now we can say for sure, because we now have the ability, with the quality of the imaging, to actually understand brain structure. With the optogenetics work that Carl Dieseroff did, We understand circuits now in ways that we never could before. And the genome, look what the genome is now giving us, the identification of what we believe are these mutations that cause this chemical imbalance. And now new therapies using transcranial stimulation, magnetic resonating, which is offering treatments and plasticity. Your last guest was talking about plasticity. These positive feedback loop, computer-based training systems to offer options for people who are just will not take drugs. We need to give a spectrum of care for them. So I'm most excited about the science. I do think that if you talk about where we are in terms of awareness and stigma, when Brandon got sick in 1990, we were probably at a 0 or maybe a -2. I think maybe we're up at a 3 on a scale of 10. So we're making progress, but we have a long way to go. You know, I just think the precision that we now have and the opportunity to not just have to rely on you know, brains from people that have been deceased to understand the structure and circuits and chemistry of the brain are going to really inform us. So the next 10 years are going to be very, very exciting, and we're going to do our best to accelerate that through these large-scale projects that we're doing and bringing to bear. So good.
Wonderful.
Yeah, yeah, good.
Yeah. Well, thank you so much. I'll leave on that note. I love that. Yeah.
All right. Catherine, thanks so much.